Hi, welcome back to USMLE team. Today's topic is USMLE scoring questions number 2. We recently started this new. In this, we are going to discuss the important questions that will help you to score more in your examination. Like our aim is you should score 99 percentile in USMLE examination. So that's why we're trying to discuss the important aspects, important concepts, okay, that you should know. Okay, so let me start with this is the question number 2. Okay, this is a ER case, this is an emergency room case, okay, or ED, that's an emergency department case. They will give the history that a patient of a 46-year-old man rushes to the ER with the signs with the history of 2 episodes of hematemesis, that's the vomiting of the blood after retching. So now I think you got the diagnosis, right? Yes. A 46-year-old man with a history of alcoholism, 2 episodes of hematemesis after retching, and vitals are stable but worried. Look at this. This is how they trick you. Okay, so now you got the diagnosis. There is a diagnosis is in your mind. What is the first diagnosis? It is the, yes, tell me, Mallory syndrome, right? This is the first. Next, what it could be? It could be a peptic ulcer disease, right? Or what it could be? It could be a Borhav syndrome, right? So now the first thing, what do you want to do? The patient will ask you, doctor, what do you want to do next? And you will answer, let me call my seniors. Okay, so is that your answer will be? No, right? Okay. Now tell me whether you want to investigate or treat, because we are not sure about the diagnosis. So we want to investigate or treat. Look, the vitals are stable, right? So what do you want to do? Observe for him, investigate. Okay, that's very important. Look for the vitals. What do you want to look for? You should look for the BP. You should look for the pulse. You should look for the respiratory rate. These are very important. Look for the signs of hemodynamic instability. Very important. If he is hemodynamically stable, then you can investigate. If suppose this patient, same history, but the vitals are the hemodynamically he is unstable, what do you want to do? You have to treat him. You have to start treatment. You have to start with the IV fluids. Very important. Take out the matching, blood group matching. Start preparing for the blood, because there will be heavy blood loss if there is any peptic ulcer disease also. Okay. And you have to prepare the empirical antibiotics also if there is any signs of sepsis. So you should look for the vitals first. A vomiting patient with a vital stable, then you have to investigate. What is the investigation of choice? The investigation of choice will be the upper GI endoscopy. Okay, remember, upper GI endoscopy should be initially performed in all patients with hematemesis for the diagnosis and the possible therapeutic intervention, whether regardless of the cause. No need to worry about the cause. Okay, so now you investigate it. When do you want to treat? Okay, when do you want to treat? Just the vitals are unstable, then you have to treat it. Okay, you have the different options. Okay, now this patient you treated, right? He's a white. Look, most of the patients of the Mallory syndrome will be stable. Okay, so what do you need to do? You need to, after stabilizing the patient, investigate upper GI endoscopy to look for the extent of the tear. Okay, and after that you can prescribe PPI for him. Okay, PPI you have to prescribe for him. And if the patient is suspected to have a Borhav syndrome, he will have a severity in the sense like chest symptoms, okay, because of the median ascites. Okay, these are very important, and he will be have a signs of hemodynamic collapse. Okay guys, so then the other important things what you should do, what you should look for is investigate and the treat, right? So remember, if the vitals are stable, treat, investigate it, and if the vitals are not stable, then you have to treat it. Okay, These are very important concepts. Okay, so this is regarding Mallory syndrome. If there is any peptic ulcer disease, there will be heavy bleeding. You need to start with treatment like a blood transfusion, then other kind of drugs, blah blah blah. You have to go ahead with the treatment. That's very important. So remember about this. This is very important. Okay, guys.